Thank you for joining me today. My name is Samir Damani. I'm a practicing cardiologist, a researcher, and the CEO and founder of MD Revolution. And I'm here to tell you today about a quiet revolution that's ongoing. It's a medical revolution that's being led not by the PhDs and the MDs in academic labs in universities across this country. It's actually being led by all of us, by consumers that are interested in technology. Over 1 billion smartphones in use today, soon to be 2 billion by 2015. It's their interest in products like the Nike Fuel Band and the Fitbit that tell you how active or inactive you've been. It's their interest in that data and how it impacts their health. And it's this convergence of interest in the technology, the data, the sensors, and their health that is enabling a new model of preventive care. That is what digital health is all about. And the reason why it's about that is because every year, the CDC just stated, we lose 200,000 people to cardiovascular disease that could have been prevented. And 6 of 10 of those deaths are in those less than the age of 65. So these are young, productive members of society. Take a step back, the CDC states that 40% of all cancers, lung, breast, colon, these are preventable conditions by changing simple body composition profiles, reducing visceral fat, improving fitness. And 80% of heart disease is preventable. And the fact that out of the 52 million deaths that occur globally, that 26 million of those deaths are from heart disease and cancer. We know we have to do something dramatic. And technology can enable that. Now, if the burden of disease doesn't get your attention, let's talk for a minute about the economic impact. Over $1 trillion every year is lost due to decreased productivity from individuals with chronic disease. And most of it is from indirect medical costs, from presenteeism, people showing up to work not functioning optimally or not showing up to work at all. In addition, the medical costs to take care of these people are bankrupting companies. This $1 trillion is expected to grow to $6 trillion by mid-century, a value that is equal or close to that of China's GDP today. It's unsustainable. And what you're hearing about is an economic crisis that is smoldering and an order of magnitude greater than what we experienced in 2008. And this time, the US Treasury is not going to be able to bail us out. Now, there's hope. In 1950, it was thought that polio would cost this country $100 billion to treat by 2000. And actually, I should say it would cost the world $100 billion. But it actually ended up being $100 million. Today, we spend $100 million to treat polio. So there's hope. We can bend the curve, both the disease burden curve and the economic curve. But it's not going to be a pill. What we're dealing with are non-communicable diseases. We're not dealing with viruses. We're not dealing with tuberculosis. We're dealing with diseases of behavior, diseases that society have created. 1 out of 2 people die today from these diseases. Well, in 1900, less than 1 in 10 died from them. So what we have to do is we have to design technology today that is leading this digital health movement to enable better behaviors and lifestyle changes. We need to take tools like wireless scales that are available in Best Buy and can give data, can stream data on weight, real time, to a health coach or to your doctor. We need to take heart rate monitors that give data on how you're exercising and whether it's effective. My patients frequently tell me that raking leaves is what they do for exercise. When you show them that their heart rate barely gets above 100, it's clear to them they understand that it's not exercise. We need to take the disparate technologies like blood pressure cuffs that, again, are available in the Apple Store and Best Buy that are being used in isolation by consumers. Bands that count the calories you burn every day. Fitbits that track your activity. And genetic tests like 23andMe. 400,000 people ordered a genetic test on their own. Not because their doctor ordered it, on their own. Because they want to understand better the risk for disease. But the problem with these technologies are that they're used in isolation. And it's not technology that has ever changed the way we do things. It's how we enable, or how that technology enables us to use the technology, how it integrates in our daily life that makes the difference. So the answer is how do you take this technology and create a loop, a feedback loop, which can take the data generated by the Fitbits, the DigiFits, the blood pressure monitors, and then create relevance to that individual. Let them know that this data shows that you're at higher risk for this. And how do we give them a plan? Which then tells them, here's what the data means, here's what you need to do in real time, because we can do that today. We can all get messages today from our physician's office, a nurse, or our corporate wellness program telling us, we noticed you haven't walked or weren't as active this week. Be more active. So we can provide feedback. And that feedback drives new behaviors, and that new behaviors drive new data. And this is the feedback loop that is created. This is what changes behavior. This is what actually provides us with better outcomes. And this is design. So what happens when you put it together, it looks like this. All the data, instead of flowing to different apps on different websites, now can come to one singular website. You can see your steps, your blood pressure, the amount of calories you took in, all in one place today. In corporate wellness programs, companies that are interested in keeping their employees healthy, these technologies can assign points in an algorithmic way that enables people to be more engaged in healthy activities, enables them to walk more, check their blood pressure more if they need to, weigh themselves more. It increases their awareness. And by increasing awareness, you've fought the first battle in the war against chronic disease. And most importantly, what you can do is you can real-time message these individuals. Not from a computer algorithm that generated, but actually somebody who's seeing that you're not doing something and letting you know that here's what you might want to do. It's your GPS. For those that turn off the wrong road, you want to get them back on the right road. That messaging is key. And it doesn't have to be your doctor. It can be your health coach, your personal trainer. It can be anyone. It can be someone you assign within your practice as a physician or within your HR department in your company. And when you put it together, what happens? What happens is that you see dramatic effects across a population. And not only do you see effects in one parameter, you see effects in multiple parameters. Because the same thing that causes you to lose visceral fat, which is the fat surrounding your organs, the fat that drives inflammation, the fat that actually drives insulin resistance and diabetes and hypertension and plaque rupture and heart attack. The same things that you do to change those are the same things that can result in improved cardiorespiratory fitness, or VO2, as you see here. It also improves your metabolism. You can rev up your metabolism by the same processes of eating in the right manner, exercising in the right manner, and you can lose weight. So here's a scientific reproduction of what you just saw. And what you're seeing here are all the variables that are measured, that we are measuring. And all these variables are surrogate endpoints that are now emerging as the most important predictors of death. VO2, for example, I just talked about, is about 10 times more predictive of death than your serum cholesterol. We haven't heard about it because the pharmaceutical companies were pushing cholesterol for so long that we failed to acknowledge that one of the most powerful predictors is how fit are you. Other parameters you see, your resting metabolism, your muscle mass, your body fat, and your weight, all can be changed by changing the way you live your life, and small changes. And as you can see here, with the red dotted line in the middle representing no change, and the blue shaded area representing 50% of the population, if you extend out to the hash mark at the end, that's 75%, you're seeing that almost 75% of people that are participating can see changes in all of these parameters in the right direction, and with no side effects. The only side effect is they get used to using these technologies, and it becomes part of their life. So if this is a pill, I ask you, would you take this pill? Would the FDA approve this pill to be taken? And would prescribers, doctors, prescribe this pill? I think all of us would agree that's a resounding yes. So what we are doing at MD Revolution, we are harnessing the power of digital health so we can take this solution and bring it to all Americans and subsequently the world. Thank you.